Well, keeping you healthy this evening, President Trump unveiling a multi-pronged effort to lower drug costs here in the U.S.
And that includes the creation of a direct-to-consumer website dubbed TrumpRX, where Americans can buy medicine at discounted prices. Now, sources say the plans also include a deal with Pfizer to cut costs of its medications. Details of that deal were not immediately clear. For months, though, President Trump has been saying drug makers need to lower their prices for U.S. patients.
These drugs will be available for direct purchase online at a website operated by the federal government. We're also announcing that moving forward, all new medications introduced by Pfizer to the American market will be sold at the reduced most favored nation cost. So we'll be paying essentially what other countries are paying, who have been much lower for many, many years.
So what does this new program mean for you at home? Some family-owned pharmacies say it could change the way they do business and even threaten their survival. 10 TV's Bryn Caswell explains.
In communities across central Ohio, corner drugstores like Linworth's Pharmacy have been staples in the community for decades. Pharmacists say while cheaper drugs may sound good for patients, the math could put mom and pop pharmacies in a tough spot and ultimately patient care at risk.
Teaming with Times.
All right. Inside Linworth's Pharmacy, owner Chad Thompson prides himself on customer service.
Things are either mailed to you or are coming that way. It's not that they're necessarily bad, it's just that where do patients get their questions answered and what do they do if something happens with their medication?
President Trump's new plan, TrumpRX, aims to cut out-of-pocket drug costs, allowing patients to buy medicine directly from manufacturers. This could mean cheaper insulin or heart medications. But for smaller pharmacies who don't have the bargaining power, there's fear reimbursement rates from insurers and pharmacy benefit managers could sink even lower. How are your margins right now?
They're pretty small.
The TrumpRX website is expected to go live sometime in 2026, but will not sell or distribute medicines. Instead, according to senior White House officials, consumers will be able to search for their current medications and will be redirected to the manufacturer's direct-to-consumer channels.
It's long overdue.
At Freedom Pharmacy in Pickerington, it's cash only, no insurance required, just a prescription. A business model switch owner Nate Hucks made within the last few years.
All of our profitability is based on our services. We don't make any money on the cost of the drug.
While Hucks has a head start over other family-owned pharmacies by already cutting out insurers, he's on board with what the Trump administration is trying.
Manufacturers, insurance companies, they're making a bunch of money. Pharmacies are making nothing.
But with direct-to-consumer options, Thad Franz, professor of pharmacy practice at Cedarville University, fears patient liability could be a concern.
Is it safe for patients to directly get their medications from manufacturers?
Yeah, it can be. I think if the checks and balances are in place.
In the meantime, as TrumpRX rolls out, both Hucks and Thompson will continue providing for their customers, offering in-person care they believe is irreplaceable. Bryn Caswell, 10 TV News.